Can everybody hear me okay?
Yes.
Yep, okay. Well, good morning, everyone. Thank you for being here. As Dr. Lee said, my name is Joe Kardine. I am an occupational therapist from Jefferson Rehab. I'm located just about a block down the street on 9th Street. I participate in our low vision program at Jefferson Rehab, seeing folks really all over the city as we have multiple clinics throughout Philadelphia. So what is occupational therapy and what is the involvement in low vision? So we are rehab professionals trained to prevent accidents and injury, teach patients new skills, especially in low vision. It's more of adapting to vision loss and maximizing performance, just like Christine had said earlier. We do a lot of work on modifying tasks that are important to you and also the environment that you live or work in. And always promoting a healthier lifestyle, focusing on diet and nutrition, as poor lifestyle may contribute to vision loss in the end. So our role in an interdisciplinary team in their care is we work in collaboration with low vision optometrists or low vision ophthalmologists, depending the service that they work on. So occupational therapy services are in various settings across the board. So we work in acute care hospitals and acute rehabilitation settings, as well as outpatient clinics. We go into the home, and that's just to name a few. There's other therapists that work in like skilled nursing facilities or maybe permanent placement for those. So do all occupational therapists work in low vision? That is not always the case. It is more of a specialty service. So some of the providers, it can be limited to the providers that do provide low vision care. It's very dependent on the location that you may be in or where the services are. So how low vision rehabilitation kind of goes with glaucoma. So a lot of it comes down to communication with your eye care provider and the occupational therapist. So as you may know, as a patient, you're always evaluated by your eye care provider, but we also will provide a comprehensive evaluation based on your function and based on the goals that you have for therapy. We teach a lot of safety techniques and strategies to prevent falls. We provide ways to navigate new methods to complete your daily routines, such as self-care, taking care of your home, getting out into the community, and then modifying those routines. Also, because of lifestyles and the risk factors, there's a lot of health and nutritional management that can be kind of performed and discussed always in therapy. And then, so getting into more of the like moderate to severe vision loss that may occur, there is the option for device training. So a lot of times people need devices for reading or for scanning their environment, or magnification to the surface that they need. So if you're magnifying reading materials or recipes or labels you may have in your home, up to lighting. Lighting can be good and bad. We assess lighting, and because of glare that may take place in some of the vision loss or symptoms that you have, we can assess that and provide the right lighting for you so it can increase your activity, whether it's at home, whether it's in the environment, or even at work. So just some safety and home tips that, one, they're good in general, but if you are struggling with low vision, it's especially helpful for you. So removing clutter, removing rugs that are always moving on the floor, and kind of managing cords that may be around the home. So really a lot of that is to prevent falls. A simple furniture setup. So in modern day furniture, sometimes our rooms get more cluttered than they need to be. So setting up your furniture appropriately may help you navigate better in your home and even in another loved one's home. So contrasting colors. So contrast is being able to distinguish what is in your environment, essentially. So the best contrast is black and white, but that's not really the world we live in. We live in this very colorful world with a lot of pastel colors. So if you see in the photo up here, that would be like an ideal setup for someone. Now, is that always the option? No. But we can take measures to make it somewhat easier. So as simple as changing the knobs on your cabinets, or as simple as identifying objects on your countertop just by changing the color of some of the surface. So also having just a common place in your home where frequent items that you use are. So your keys, maybe your phone, even an envelope opener, have a common place such as a basket where you can store these items. And like I discussed about lighting, so when someone has maybe more moderate to severe vision loss, their eyes take a longer time to adjust to the environments that they're in. So especially at night, when you're coming from a dark room, maybe into the bathroom that's lit, it's best to slow down and take your time to be able to adjust and really know your environment, especially if you're in a place that you're not familiar with. Your home, it may not be an issue, but if you go to stay with your children, or maybe you're at a hotel, or you're on vacation, keep that in mind to help yourself not get hurt. Also, night lights, flashlights, and hall lights are vital. I think they're vital in general, but especially with someone who's having mobility troubles, it's best to have at least one light in the hall, one light downstairs, or just in the family room, especially if you have to get up in the middle of the night to go to the bathroom or go get something to drink. So some organizational tips, such as medications. So large print labels are available. You can ask your eye care provider or ask the pharmacy that you go to. They are able to make these accommodations for you, but you have to kind of advocate for yourself in that way because they won't know. Coordinating your pill bottles uniquely. So if you are more of a systematic person, having your pill bottles set up in maybe the order that you take them or by the times that you take them. And also, when you are prescribed new medications, always ask about them. Always advocate to make sure that you know exactly what it is for and how you're supposed to take it. Because whether it's eye drops or it's an oral medication, if it's new to you and you don't ask, your physician will think, okay, they're on board and they totally understand. But if you don't feel that way, it's just important to speak up. So organizing the kitchen area. So it's a very commonly used area in your home. So organizing the refrigerator. So modern day refrigerators have a lot of drawers or areas that are even labeled now. So having, again, like more of a systematic approach even to the refrigerator of having kind of categorized areas in the refrigerator. Having recipe books that are in alphabetical order, hanging kitchen tools rather than having a cluttered drawer where it may be more difficult to see. Kind of like how I spoke earlier about contrasting colors and the lighting in your home. Using timers and applying materials to your appliances in your home. So a commonly used approach that I have people do is putting a little lime-colored sticker on, if you have a knob for your oven or your stove, on like the 350 mark. So you know if 350 is a common temperature that you use, you'll know that that is 350. That's just one example of many that can be used. Also putting certain materials on the buttons on your microwave, having that maybe for the odd numbers on your microwave. So if you're having trouble seeing the numbers, it's kind of more using your thinking than your vision to operate it correctly without any cause of fire or harm to your home. Finances. So if someone lives alone and they're still in charge of their finances, there's ways to do this and to be active in that. Having kind of an organizational setup for colored trays or folders for your bills or for specific things that you are responsible for. There are large checkbooks that can be purchased. They have them on Amazon. There are other resource companies that will provide these for you. So, if you are unable to search for them, it's best to ask for help so you can access these tools for you if you still manage a checkbook and still are the sole person for your bills. So if you're using a computer for online banking, there are ways to make your screen bigger. And there are also ways to make your screen lighter so you can still do the things that you need to do to not fall behind and to not have more stress in your life than you may already have. So just some community tips. Use the remaining vision that you have more efficiently. There are scanning techniques, paying a little more attention to your environment, but always being proactive. Try and slow yourself down as best as you can. Know your environment before you step into it. Oftentimes with patients, it's the first thing we will approach in their care. Especially being in a metropolitan area, it's a little more dangerous. And so we have that capability to do that type of training. So using more head turns, but using the remaining vision that you have and maximizing your performance to prevent any harm or injury. If you are prescribed equipment from your eye care provider, use it in the community. If you're able to bring it with you, it's best that you bring it to the store, you bring it to a loved one's home, so you can continue to use it without trouble. Making lists, for example, when you go to the grocery store, make a list in the order that you're actually going to shop, so you don't feel like you're struggling to look around the store to find what you need. Again, have more of that systematic approach to make your life a lot easier. Another way just to compensate if you can't get out into the community is if you are able to shop online or use delivery services for groceries. I know that is more of a common thing even in my generation, but also for folks struggling with low vision. They normally charge like a $5 or $10 delivery fee. So sometimes that's a barrier, but sometimes it's a good investment for safety. Also, when you are at the store and you are maybe having trouble even using strategies, always ask for help. Sometimes it is the unseen injury, so people may not know what you're going through. And people at the store, they are big on customer service. It's a customer service world, so always ask for help. People are very helpful in the store. When I take patients out to the store, you can kind of role play. Let's just say I'm not there. How would you approach someone in the store to ask for help? It's something we think would be very simple, but it's not always that simple. And so the big question always is, how do I access these services? Where do I go to find that this even exists? Sometimes you can discuss, a therapy with your eye care provider or your primary care doctor. Christine McBennett is available from the social worker standpoint about services. Asking a family member to help maybe look on the internet about low vision rehabilitation. At Jefferson, there's a few locations that we have, so that service can be provided for you if transportation is an area of difficulty for you. And so what is needed for therapy? So just like if you were going to physical therapy for pain or an injury, your doctor typically provides a therapy script. So the great thing about occupational therapy and eye care providers is that an eye care provider is legally allowed to write a therapy script to occupational therapy. So number one, that bridges a gap. But number two, that makes your care better because of the communication that we'll have. And I'll get the evaluation from your eye provider, and they will get my evaluation and continue treatment notes. So when you go in for your follow-up, they'll know how you're doing. And they'll know that you're doing really well, or maybe there's some more area of difficulty that they didn't know. So devices in low vision rehabilitation. So as a therapy provider, we cannot prescribe devices just like we can't prescribe lenses and we can't prescribe medications. So sometimes we make recommendations for devices and we communicate that to your eye care provider. And we always give reasoning and information to them So they're like, well, why are you asking? Well, here are the facts, and here's how maybe they demoed this in therapy, or we know the benefit of it to help you. So we'll have that communication and try and have that process as easy as possible for you. Also, we're advocates for you for funding resources. We utilize the community resources and try and connect you with them. As copays are difficult, we know that we're not the only appointment that you have. And especially in glaucoma, you're going to follow-ups maybe more often than not. So we're just essentially an added cost at times, and you may feel that way. So we're there to help you and navigate those difficulties that do occur. And the same thing for community resources. So, working with the Association for the Blind that's here in Philadelphia. I work with them and communicate with them to maybe they can provide something that I can't. Or maybe they have the same thing, but it's cheaper, or it's more along the lines of a donation for you. So we always make your care about the best interest about you. And it's not just about, constant copays and constant treatments. Okay. Does anyone have any questions about low vision rehab? Yes?
May I ask you, there are medical advances to the point that there is some medicine cure for glaucoma or macular degeneration?
So is the question, are there cures to glaucoma?
Yeah, are there any medicines?
So I can't speak for the eye care providers about that topic, but the earlier you seek treatment, the better off you not having vision loss may be. When you do have vision loss, especially when you're in a moderate to severe stage of vision loss, it may be a lot harder to gain vision back, but really the focus then really isn't restoring your vision, but maximizing your vision from my standpoint.
Mm-hmm.